I'm welcome to Activate and Thrive. We are Don Krishnaswamy and Mia Krishnaswamy, and we are very excited to bring you each Thursday our Thriving Thursday interview with beautiful health-minded souls. So just welcome to our page. If you're watching this live, you can please feel free to drop a question for our special guest in the chat, and we'll do our best to answer it, bring it up in the interview, or any comments you have. So we'll turn it over.
We're here today with our special guest, Joanne Shearer Parkin. Joanne is in Arizona. It's much warmer there than it is here in Massachusetts, where Dawn and I reside. Today, we're going to be sharing some health tips with you about how you can take charge of your health. February is Heart Health Month, so we decided to wear red. Personally, both Dawn and I are very passionate about that. My mom died 9 years ago from heart disease, and she was here one day and gone the next. And Dawn's mom, it was the same situation. So we're going to be talking about just some of the choices that we can make to help optimize our health and how we can get ahead of the curve by taking charge of our health. Specifically today, our discussion is focused on heart health. And Joanne Shearer Parkin is our guest. Joanne is a MSRDN registered dietitian and master's level nutritionist with over 40 years of experience in multiple practice settings, including 15 years as a certified diabetes educator, while employed as the director of nutrition services at a heart specialty hospital. Joanne received several awards and recognition for her innovative and creative nutrition programs. Joanne has held numerous leadership positions in the Academy of Nutrition and Dietetics and was instrumental in the development of the standards of practice for the dietetics profession. As a founding member of Dietitians in Integrative and Functional Nutrition, Joanne has been instrumental in educating other dietitians about natural health and natural products. Joanne is known as a trendsetter dietitian, having been at the forefront of numerous trends in nutrition and dietetics. And she's now at the forefront of another trend in nutrition, nutrigenomics, how naturally occurring compounds can affect our genetic expression and NRF2 activation. And that is really how our paths crossed and connected. So welcome, Joanne. We're so honored to have you with us today. Thank you so much.
Oh, thank you for inviting me. I'm excited to be able to speak to your audience today. This is going to be fun.
Well, that's great. You know, maybe we can kick it off with the fundamentals, perhaps. Like, could you talk to us a little about really what's at the root of heart disease, the root cause? You know, people may think it's one thing or another, but let's talk a little bit about that.
Okay, sure. Of course, there are many factors that contribute to heart disease, but if you really want to get down to really what is root cause and where does it really all start? In fact, it actually starts early on. I mean, they've even recognized that young men have build up in the United States, particularly already, young men in their 20s and 30s already have a significant buildup of fatty streaks and plaque in their arteries. So this process actually begins early. You don't all of a sudden at age 65 grab your chest and have a heart attack and say, gosh, it was that hamburger I ate yesterday. It's no, this is the process goes on for years. And I was when I was at the heart hospital, I think that's really when I learned about oxidative stress and inflammation really being at the root cause of heart disease. And for a lot of people may have never heard of oxidative stress, and actually, I had been hearing about it, and this was back in 2000, and I'd been hearing and reading articles about it, but it really came home to me when I was there and started reading the cardiovascular literature, and especially as it related to nutrition and how we could prevent, heart disease and what could we do, because we knew at that point in 2000, we knew that 80% of heart disease was preventable. So why are we still having, heart disease as being the number one cause of death when we know what we could do to prevent it? And so what I found out is that this theory, this free radical theory of aging was really what was at the root and cause of heart disease. So just to kind of boil it down, make it kind of simple, because people are saying like free radicals, oxidative stress. I'm throwing out a lot of big terms here. What is that? Well, oxidative stress really is the damage done to your body by these toxic molecules called free radicals. Now, those free radicals, where do you get those? Well, first of all, you know that we've had 85,000 chemicals introduced into our environment since the Industrial Revolution. I mean, we're really not designed, I don't think, quite designed to really handle all that much, because those chemicals are all a source of free radicals and free radical damage to our cells and to our bodies. And so how does that relate to heart disease? Well, let's think about, we know about, LDL cholesterol. When you go to your doctor, the first thing, almost it's routine that they're going to check your cholesterol, right? You had your cholesterol checked and you've loaded the printouts, right? You've got HDL and LDL and you've got the total, right? Well, the number that the doctors are going to look at is that LDL, lousy cholesterol. And that lousy LDL cholesterol is not necessarily harmful until it is oxidized. And what do I mean by oxidized? What I mean is when your cholesterol gets damaged by free radicals, right? By those toxic molecules. That then activates your immune system. What happens then? You get what? Inflammation, right? So the two run together.
Yeah.
Bad apples that run together, oxidative stress and inflammation. So you're activating your immune system. These molecules, these cells in your immune system called macrophages, they're called big eaters.
Yeah.
They gobble up this damaged LDL particle and they go, ooh, where am I going to put this? Because they recognize it as being like a virus or an invader. And where do they put that particle? Well, the closest place to put it is where? Boop, right into your arterial wall. Right? So do you see the process, how that happens?
Yeah.
Oxidative stress, inflammation, plaque buildup.
Yeah.
So that's the process. So
Yeah.
really, what we have to think about is that. So when I was reading in all this literature and I thought, man, I'm hired here, I have to be the specialist in cardiovascular nutrition. Had been a specialist and worked in so many different areas, and I knew how important it was to be current on the science. So I go to PubMed.gov, I'm reading about what's the best diet. And in 2000, the American Heart Association was saying low fat, low cholesterol, low fat, low cholesterol. Well, we now know that that was the wrong approach. But what I was finding was that the Mediterranean diet was most scientifically validated to not only prevent heart disease, but also could really prevent future heart attacks, even in people who've had heart attacks. And I'm like, wow, that's a no-brainer. And so the reason why the Mediterranean diet works so well, it's because it's that combination of the nutrients in the Mediterranean diet. It's the whole package deal. It's not any one food. It's the package, right?
Yeah, absolutely.
And it's the most scientifically validated diet that can lower oxidative stress. And of course, when I read that, I had read, oxidative stress, root cause of heart disease, right? Caused by, free radical damage. And then I go read, the Mediterranean diet. It takes care of that.
And the Mediterranean diet is rich in omegas and fish, right?
Omegas, big time in omegas. Absolutely. Omegas, green vegetables, leafy greens, all kinds of fresh fruits and vegetables. Olive oil, 40% of the fat, 40% of the calories in the Mediterranean diet, it's from fat and mainly from olive oil. Olive oil is potent and powerful at helping to prevent cardiovascular disease. And of course, what is everybody using in 2000? Canola oil, soybean oil, vegetable oils. Not olive oil wasn't big. It's huge now, extra virgin olive oil, because people have learned that. Yes.
So you were the first to really adapt and modify the Mediterranean diet for heart hospitals, right?
That's right.
So what,
That's right.
What
to my
was,
knowledge, I'm the first.
so what would you say was what made you realize you wanted to do that, to take it to heart hospitals? Right?
Well, I had told somebody, in fact, this is a well-known chef consultant to hospitals, told me it could never be done. Nobody should ever tell me that, right? It could never be done. This would never succeed. And I just decided that I was going to put everybody in the hospital on the same diet, which is really rare, and it's still rare today. Doctors, the patients, everybody in the cafeteria, on the same diet. It was going to be this modified Mediterranean diet, because I knew that Mediterranean diet would be a hard sell in South Dakota. And how are you going to get, because 70% of our patients came from the rural areas, farmers.
Right. Yes. Red
And,
meat.
I mean, they would just take that piece of paper I'd get them, hey, here's your dietary pattern you want to follow. They just like throw in the garbage. So I had to really be, I had to be creative on how I was going to do that. So what I did was I took and combined the best of the traditional American diet. I'm not talking about the standard American diet. The standard American diet is, what we all know of as the fast food diet that
Right.
a lot of Americans consume. I'm talking about the standard American farm diet that I grew up eating. Food right off the farm, right? Fresh from the farm. So I combined a lot of those foods within this Mediterranean diet. My focus with that was that I knew that people in the Midwest, that we were not eating enough fruits and vegetables.
Right.
They were not eating olive oil in their foods. They were not, incorporating fish. That was not traditional in that area. So my goal was to not just tell them, don't eat this. My approach was, and I think is the best approach, is say, these are the things you need to add into your diet. You need to be eating more of these, because when you're eating more of these, you're naturally going to be eating less of those.
Yes.
Right.
Less red,
Yes.
instead of the steak being the center of your plate. Simple idea, just, hey, make vegetables the center of your plate. You can still have your red meat, but think of it as a complement, almost like a condiment or a complement to that.
Yeah.
So this was my approach. So
Less is more.
You kind of turn around the main entree idea into the
That's
greens
right.
and everything. So we have one of our guests on here, Marisa, who is saying that it's actually her favorite way of eating. It's not a diet; it's a way of living. So if we can maybe bring
right.
this
Great. Way to go, Marisa.
bring this full circle with our focus on heart health. And so for those who are concerned about that, want to be sure they don't develop heart disease, talk about other aspects of the way of living to,
Yes.
whether it's exercise, or I think you've talked a little about the foods to avoid, but just
Yes.
what's involved in the way of living here with the heart.
Okay, so I think that obviously, and it's just we know this from from any chronic disease, is that in order to prevent that, you need to be moving your body. You need to be to be physically active. That is essential. You need to be managing your weight. The kind of weight that particularly is harmful and can double and triple your risk of heart attack and heart disease is this belly fat, the fat you carry above your waist. We also call it the visceral fat. That is the most damaging. And when it comes to heart disease, because that fat generates inflammatory compounds, increases insulin levels in your body, which also can lead to more heart attacks. And so that's particular when you're looking at, weight management, that's the place to target. Any kind of managing your stress, of course, is critically important, because stress plays a role as well. That's so important. I think having good social family connections, just all of the things for healthy living that we know is critically important for just overall wellness and staying healthy.
Yeah, it's a lifestyle, isn't it? It's not one thing. It's not just your diet. It's not just your exercise. What do you do when you wake up in the morning to care for yourself, your state of mind? Do you take the time to quiet all the chatter that's out there that's, calling you to do this, to do that, to do that? It's like putting the oxygen mask on yourself first, right?
Oh, Mia, you're
So-
so right. Having an attitude of gratitude,
Mhm.
Having that mindset, prayer, meditation, how that is so important, for living well and living healthy. Absolutely, totally.
Yeah. It all is a contribution to a lifestyle choice so
Yes,
that we can be thriving. We can
that's
feel
right.
activated and thrive.
Have you seen
Exactly.
differences in people who have that mindset, who are really actively turning to prayer and thought and meditation in
Absolutely.
impacting this?
Oh,
Yeah.
absolutely. Yes. I've seen that, so much over the years, and even in my own personal health and in my own life. Just spending time in prayer and seeking. First thing I ask when I get into prayer, if I have my health all of a sudden is I'm having a health condition, is the first thing I ask. I say, "Hey God, show me what I can do to change my life.
Mm.
What do I need to do to be, what choices do I need to make that are different, and listen and follow that leading as well. And so that's what people can do. Um, a lot of people pray for healing, and we also need to pray for health
For
and good
health.
health
Yeah.
and what we can do personally to change that.
Absolutely. Could you speak a little bit about what I touched on and how our paths crossed with this
Yeah,
whole
yeah,
new area in the health sector called nutrigenomics and
yes,
NRF2
yeah.
activation?
Yes, it's amazing. When I was working there at the Heart Specialty Hospital, I had a cardiologist that introduced me to a NRF2 activation. And he was educating me, and I'd never heard about NRF2 activation. And it was really fascinating. And it fit in so well with what I knew about the Mediterranean diet and the root cause of heart disease. And through nerve 2 activation is powerful at lowering oxidative stress.
Can
And
we, for those who are new, NERF, can you speak
yeah,
about that? NERF?
NRF2.
NRF2.
Yeah,
Right.
NRF2 activation. And you want to know, people ask me, well, what does that stand for? Well, it's a word about this long, and that's why we say NRF2.
NRF, that's sufficient, I
I
think.
actually do know it's nuclear respiratory factor. Is that right? Do I have that?
Nuclear erythroid factor
Okay.
like 2 something or other,
I'll leave
right?
it to the
So,
experts.
right, so NRF,
I know it's good.
NRF2 activation, that's a great
Really,
concept.
it's a potent NRF2 activation. It's NRF2 is really a very potent anti-aging pathway in the human body. There's about 20 of those anti-aging pathways. We know more about. There's about 3 of them that we really know quite a bit about, but they're discovering more all the time. But NRF2 is really potent and powerful. If you go to pubmed.gov, anybody can go there. It's P as in Paul, U B as in boy, M as in Mary, ED as in dog, pubmed.gov. And you can read all the research on NRF2. You just type in NRF2, and you'll get
Perfect.
about, I think, 30,000 research articles. So,
And
That's
you can
amazing.
see how that trend has just had an upward swing with NRF2 activation or NRF2 activation,
right.
and how that pathway is really responsible, isn't it, for our antioxidant production?
That's
It's
right.
the
It is, right. And NRF2, right, what it does, it activates our cells to make our own antioxidants, antioxidant enzymes, because we all know about antioxidants, right? So we've been, that's been the buzzword what for the last 30 years, antioxidants, antioxidants. And why antioxidants? Well, antioxidants. So free radicals are called oxidants, right? Free radicals are also called oxidants,
Oxidants, right.
right? So then antioxidants, what do?
they
Well,
zap.
yeah, they zap them before those free radicals can, damage our cells in our bodies. So that's antioxidants. So that's why, the big push over all these years. And that's fabulous because, you want to eat as many, that's why you want to eat as many of those, colorful fruits and vegetables and combine them together, antioxidants, olive oil. Look at olive oil is loaded with antioxidants, for example.
Mhm.
So you want to combine those all together, to provide as many of those diverse antioxidants as you can. However, there's another source of antioxidants. They're inside our cells. And these antioxidants inside our cells are up to 1,000,000 times more powerful than the ones we get in food and supplements. Think
So
about
when people say, well, I eat really, really well and I eat really clean, so I know that I'm taking care of my body in the best possible way. And of course, that's very important to do that and eat our leafy green
that.
vegetables and to eat our fruits. But wouldn't you say in this day and age, it's just not enough? There's
Not
so
quite
many
enough. Right, right.
toxic, you
Right.
know,
There,
elements coming at us.
it's just hard to, and that's when I first learned about, that there were nerve 2 activator natural products on the market that, that's what, I learned from my cardiologist friend. And he was the one who really taught me and educated me about this. And so I started taking the, little yellow pill, nerve 2 activator myself, and started, getting the word out about it. And that's how we eventually, years later, connected. And so that, and so it's really makes a lot of sense because I thought, well, this really makes sense.
Mhm.
The Mediterranean diet, it's powerful, lowers oxidative stress. It's also the most potent nerve 2 activation diet.
Mm.
I
Mhm.
didn't learn that till just about, I think it was about 4 years ago.
Yeah.
And I really like, hey man, I'm on the right track here. This is, this diet, this Mediterranean diet. I learned, lowers oxidative stress, inflammation. And now I learned, light bulbs went on like big time because it's the combination of the foods in that Mediterranean diet that activate this this anti-aging pathway, nerve 2.
Right.
So it's not only just the direct antioxidants you're getting in the Mediterranean diet, it's the fact it's the synergy of those foods then
Yes.
that activate that as well. So you're getting both. You're getting the direct antioxidants, and then you're getting all the indirect antioxidants as well. Your cellular antioxidants, these potent medicines that are just sitting inside our cells
Right.
and get them activated. I was going to say that, those antioxidant enzymes, the production, they decrease as you get older.
Yeah.
Mhm.
Yeah. So if
So,
we can activate our body's ability to make its own,
right,
it's much more effective than taking something and just,
right,
supplementation is when you're adding to something that's deficient, but we're actually activating what
activating,
already exists.
right. It's
So I
already,
guess I guess we'd be giving ourselves, so we say, a fighting chance going forward with things like heart disease. Not to
yes.
say that it's a definite cure by any means, but
No,
just helping activate the body to do what it's made to do. And if
right.
anybody wants to know more about NRF2 activation, please feel free to message us at Activate and Thrive, and we can tell you more about it. We can even connect you with Joanne, our
Yes,
beautiful guest here today,
absolutely.
to share more with you about it. It's an important area in preventative health and in the body's own antioxidant capabilities.
Right, exactly.
So, well, it's really fabulous to have you with us today, Joanne.
Yes,
You've given us a lot of things to think about and important information about how we can, stay healthy in our hearts and in our minds also.
And in our
So, yeah.
bodies. She was playing pickleball yesterday.
That's right, a big pickleball
that's,
champ, right?
I'm working at trying to move up to the next rank in my pickleball game. So
Oh,
I've been
wonderful.
really drilling and practicing and working, and it's great. I can still be an athlete at age 71. I
That's
didn't have a chance
fabulous.
to play sports in high school or college, just wasn't offered to me then.
Yeah,
So I
yeah.
never played a competitive sport. I didn't start till I was 65, 66.
Wow. Well, hats off to you. You're a walking testimony. Well, thanks everybody for joining us today at Activate and Thrive for our Thriving Thursday. Please plan to join us each Thursday at noon Eastern US time, where we'll have a different, beautiful, health-minded guest each week. And thanks again to Joanne Shearer Parkin for joining us today and sharing her wonderful perspectives and expertise.
Thank you for having me on.
Okay.
Thank you so much.
Thank you. Bye-bye.
We'll see you next week.
Bye-bye.
Bye.